We got a countdown.
Okay,
3,
3,
2,
2,
1.
1.
Hey!
Hello. Well, welcome everyone to the show. We were so excited. We've been, really excited to have this conversation. I don't know, Laura, how long? A few months?
2
A few
years
months?
in the making. No,
2 years in the making and counting. Well, it is time. It is time to have the Jasons, both Jason Bush as well as Jason Leibert from Solnul joining us on the podcast today to learn about all things ingredients, but then also the journey of creating a business as well. Working in product development, we love to learn about new tools for our toolkit. So I think this conversation is certainly timely, especially as we're looking at functional health as well. So I'm not going to drag out this intro. We'd love to hear from you both. Share a little bit about yourselves and also what you're building at Solnul.
Yeah, I can go first. So great to be here. Thanks for having us, Jason and I on. So I'm Jason Leibert. I'm the Chief Growth Officer, part of the founding team of Solnul. My background, business background. So I've been fortunate, privileged enough to work with some brilliant scientists along my journey. Been in life science, biotech. Yes, for 15 years or so, being a builder, building things from the ground up, from a curious question to scientists proving there's merit there and filing patents and taking it to market and working with some of the biggest companies that we know around the world. So, very passionate, excited about the collision the microbiome is having for us in food, pharma. It's kind of right in the middle of the space and the time we are in. And I sit on boards. Research Manitoba. I've recently been on BAM. So really trying to use science and working with scientists to unlock where we go. And I live in Winnipeg, proud Manitoban, reside in Winnipeg with my wife and two girls, Sloan and Kinley, that are 11 and 12.
Oh,
Wonderful.
wonderful.
Well, thank you.
Jason, over to you. Bush, Jason Bush.
Hi. Jason Bush, the other Jason, yeah, the lesser Jason. Well, I guess we'll find
No.
out. So I really have no business being in the food industry based on my education. So I did like an undergrad in zoology, like animal science, and then did a PhD in genetics, essentially developmental biology. Very curious about how genes can kind of pattern developing organism. And I went on, did a postdoc in epigenetics. It's very kind of academic focused. And if you had talked to people like my peers and friends around that time, they'd be like, yeah, he's headed to be a professor. And then of course, like many of us in that role, you kind of reality kicks in and you realize that there's no role, there's no job, there's no paycheck at the end of that pathway. And so I had to pivot and kind of through a little bit of some hard times, kind of moving back in with mom, bringing the family back into the house. But eventually it kind of led to me connecting with our former owners, who were at one point the largest potato farmers in Manitoba. And around that time, they were starting to do clinical studies and research, and we just clicked. We found a real good combination from my background, my experience, and kind of my passion, my curiosity around kind of the complexities of life. And I don't think you will find a more complex system than the microbiome. And so, it's been a journey. Jason and I joined the company around the same time. And I've been really, really lucky to be a part of this, and right place, right time. I mean, everybody's excited about the microbiome. So I am fortunate. I live just outside of Winnipeg, so I'm not a Winnipegger. I don't identify that way. I'm also a proud Manitoban. And live with a blended family of 4 children, a dog and a cat. So happy to be on the podcast.
Amazing.
Thank you. Thank you for sharing.
Thank you.
Well, Yeah, go ahead, Christine.
I was going to say we were told we might see an appearance. The puppy might make an
Yeah.
appearance at some point. So if that happens, we're here for it. That's okay.
Yeah. Well, you both said the same sort of wording, that asking the question, what is that? What was that spark? What was that curiosity? What was that question that was asked? When you joined this company, what was that moment?
Yeah, for me, so I came from a company that was working on commercializing, developing technologies in the biofilm space, and I was I was a point in my career. Several folks said I should connect with the former owners, that they could use a guy like you in kind of in the role or in the work they wanted to do. And for me, to be honest, I went out there. Jason had got hired on, and I'm not a scientist, and I knew everything. The former company I was at, and they had strong scientific. The scientists were awesome, were brilliant, and I had Jason in the boardroom when I went out to Carberry, Manitoba, to our plant, and I was like, "Hey, if we're going to do this and we're going to build this, I'm going to need a really good scientist on the other side of the table, or in the co-pilot seat, or whatever you want to say." And that was part. You don't know where these journeys are going to go. They're definitely not a straight line, and so it's like, do you have the curiosity? Do you have the technical talent that we can unlock? And to me, that's where I said, yeah, I want to come on full time, want to join, and want to build this, because we didn't know what we were probably biting off, but it was definitely going to be in the right direction.
Yeah.
And for me, I think the moment of curiosity, like, to be honest, like when I saw the posting and it was in the dietary supplement space, I felt a little nervous, right? So given my background, like, everything is pharma centric, right? It's a drug, you go to a doctor prescribes something. And so I was a little wary, but I also didn't really have at the time a strong appreciation for the microbiome. And once I kind of got involved and started, doing the literature review and starting to think about that, one of the things that really clicked for me as kind of that motivation and that opportunity is that when you look at you know say genetics, right? All of us have essentially the same genome, and if there's something wrong with your genome, there's really not much we can do. Now, people are working to change that, right? Like, that's a very exciting space. But when you look at your microbiome, now here's something that can change, right? Now you can modify who's there, the microbes that are there, with probiotics, but you can also modulate how that microbiome is working. And so what really clicked for me was the opportunity to really help people, right? To kind of work within this messy, complex system that is the microbiome, and to introduce, if you do it correctly, if you choose the right input, you can introduce that item, that ingredient that helps to unlock health. And so it really felt like a full circle moment for me, right? That interest in biological complexity, and now being able to embrace that and harness that complexity in a way that can actually help improve people's lives.
Really interesting. Unlocking health and essentially finding those components that not necessarily changing not changing it from a genetic perspective, but you are looking at the inputs that'll really bring benefit. So for our listeners who are just perhaps joining right now, Solnul, what are you creating, and something that folks can sink their teeth into and understand a little bit more of your world?
Yeah. We like to say we're your microbiome's favorite food. It's a bit of a tagline. So
I like that.
Solnul is an upcycled prebiotic fiber that we make in Carberry, Manitoba, at our facility. It comes from potatoes, and it's a resistant starch, so type 2 product that we make. And as Jason kind of was alluding to, where that's our product. We sell an ingredient. So just from a business model standpoint, we're B2B, and sell the ingredient to partners all around the world, based on, some of the information we've unlocked on the gut microbiome and host health changes.
Yeah, I think what's really neat from a scientific perspective is understanding how you've unlocked this ingredient, but you're putting science first. And I'm wondering, Jason Bush, if you can share this role of clinical trials in terms of bringing ingredients to the market, because I think it's super important. I'm not, in food, it's very different from supplements on the pharma side. So I'm wondering if you can share what that journey is like in terms of proving the science and showing that the science is there.
Absolutely. So, like, flat out, having clinical data to substantiate your ingredient is a must-have in the dietary supplement space. If you don't have that, nobody's going to take you seriously, no matter how great or how promising your material may be. The real moment for us when we felt like we unlocked the potential with Solnul was when we conducted our low-dose trial. And just to kind of back things up a little bit, our product is a resistant starch. And people know what starch is, right? Starches are bad. Starches contribute to glucose spikes, right? All these other things. But resistant starch differs from regular starch in that your body can't break it down, right? Like, you will get no glycemic impact when you consume resistant starch. But what happens is that the microbiome can digest it. It can break it down. And one of the cool things about resistant starch is that resistance to our body's enzymes is actually based on its structure. So these are big crystals. Think about it that way, when you're ingesting these things. And what happens is that crystalline structure protects the starch from our body's digestion, but it makes it to the large intestine. And there, the microbiome has all sorts of tools to unlock and start breaking that down. And resistant starch has been known for a long time. A lot of initial research was really based around the idea of trying to blunt glycemic impact. For that reason I just described, if you replace a digestible starch with resistant starch in a muffin or in a cookie, right, that glycemic impact drops. And so the initial research done on this was done at really high doses, right? Because if you want to blunt a glycemic impact, of course, you want to throw as much resistant starch as you can in there, right? But what happened is that when people eventually said, hey, you know what, this material is not being digested, it's probably acting like a fiber and maybe even affecting the microbiome, those researchers, they kept running with these really high doses. So the whole literature, the scientific literature around resistant starch is all around that really high 30 to 50. People are still doing studies like 70 grams per day. So, like, can you imagine taking like 100 grams? Like, it's crazy
A
what
lot
they
of
make
cold
people do.
potatoes. Yeah.
Exactly. And so we said, well, if resistant starch is really a prebiotic, then it should act at a prebiotic at prebiotic-like doses. And so that was our kind of secret sauce. We kind of cut to the chase by looking at a clinical trial that evaluated resistant starch as a prebiotic at doses where it made sense, right? Where we could now unlock that opportunity and get it into dietary supplements. I'm happy to talk further on the research side. Of course, that's my baby. But that's really the key there. By doing that, showing those increases in Bifidobacterium, Akkermansia, two key players in the microbiome, along with improvements in stool form, that was really what got us off and running in 5 years ago.
Wow. And how low is the low dose?
That was going to be my question.
How low
do you go?
How low?
Yeah.
How low do you
3.5
go?
grams.
3.5
grams.
3.5
And that
grams.
equates to
Easy to
about
convenient.
a teaspoon of material.
Okay.
Wow.
So mostly so when it came to the clinical trials specifically, like, how many people are involved in this in terms of consumers, and what does that look like, even just from a structure standpoint?
Yeah, great question. So the dietary supplement space is tricky. When we think about comparing clinical trials in our space versus pharma, they look very different. So in order to substantiate what they call structure function claims in the American market, you need to study these products in healthy people. Okay. So not diabetics, right? Not people with, constipation or diarrhea, but otherwise healthy people. And so that really increases the complexity and the challenge of actually being able to substantiate a benefit. If you were to study, a cholesterol medication and somebody doesn't have high cholesterol, what do you what are you actually looking for, right? Like, are you expecting to see a
Mhm.
difference? And so that's kind of one of the major challenges. And so we started our study with about 25 people in each arm, and we measured them taking the product every single day for 4 weeks. And we measured the composition of their microbiome using stool microbiome testing kits. But we also had them follow a daily diary. And this involves kind of, it's kind of gross to say, but looking at what's called the Bristol Stool Form
Oh,
Scale,
yeah.
which is like
Yeah.
7 different pictures of poop and saying, this is me today, scoring that value. And then we kind of analyze that change over time.
Mm.
And what was really remarkable and really important for us is that despite those people being healthy, we still saw improvements.
Really
Wow.
interesting. Yeah, that's an interesting chart. Maybe we
Yeah.
can even
Another
it's so helpful
another
though, because it says a
podcast.
lot.
Yeah.
It says a
Yeah.
lot about your health and your digestion for sure.
Absolutely.
No, that's really interesting. I'm like envisioning people circling the chart today. But that's really fascinating. And Jason Liebert, you mentioned as we kicked off the byproduct piece. So the
Mhm.
byproduct in the potato industry. So what does that look like? And also curious if that's also something that you do share with businesses and how important that is. Perhaps
We
a bit of
do,
a loaded
yeah.
question.
We're an upcycled ingredient. We take a co-product from the potato processing industry. So just like you would cut a potato at home, you'd see those starchy aqueous granules maybe on your knife, that water. So those starch granules that get liberated, we're able to bring back to our facility in Carberry, wash, clean, work them through our proprietary process, and then, yeah, obviously sell an end using product. But we're very bullish on the Upcycled Food Association. A shout out to them. They've been huge supporters of us through our journey. We were one of the first products I think there was 3 products at the time that got Upcycled Food certified. So our ingredient has a certification. So for those brands that are looking, ESG is at the boardroom table, or they're wanting to be more sustainable, it's very complex, right? For brands to do packaging, supply chains,
Mm-hmm.
all that. And so we work with several of our partners have that upcycled certification that they're able to put on and communicate to consumers. So upcycled's a big part of our journey.
Yeah, we'll certainly add that link to our resource page on our show notes
Hmm.
there. I think that's great.
Mhm.
Um, I think what is interesting is, the development of the business in Manitoba, right? And showcasing that there is another pathway or another way to use some of these ingredients that are, sorry, byproducts of a processing. And I think that speaks really strong of what Solnul is bringing to Manitoba, and of course, proud Canadian here, and making sure that we do bring this to market. But I'm curious, how is your product available for the North American market, or are you just looking at Canada at the moment? What does that look like in terms of your business strategy?
Yeah, so we currently, as it stands, we sell Solnul around the world. So we first started in the US. Still our majority of our partners in that are south of the border. So
Okay.
we have about 100 products now, 100 probably
Wow.
15 products available around the world. You'll see our brand partners in Target, Walmart, Whole Foods, you name it, kind of the
Great.
biggest retailers. And that's what's been really exciting. We talk about the research in that, and it's great. It's wonderful. That's where it all should start. But then
Mm-hmm.
we don't want to we're not going to impact our communities like they need more than ever today, the impact, if we can't commercialize and get these products into
Mm-hmm.
consumers' hands.
Mhm.
There's many reasons why that doesn't happen: tolerability, economics, supply chain. Like it's so complex. And so it's very rewarding to the Solnul team when we're able to, take the research Jason's led and now see it come to action with some of those brand partners at the biggest retailers around the world.
Yeah, that's amazing. I think Laura and I, we were at a Whole Foods and we flipped over a bag and we
Yeah.
saw the ingredient in the back of it, and it was more of a powdered supplement.
Yeah.
So that's one pathway. What are some of the other categories that you're really seeing your ingredients in?
Yeah, I'd say that's still a majority of our applications. So like innovation falls on a bell curve, right? You get the early adopters that want to pick you up, that are willing to go after and reach and what you're saying, and they're very curious. But we're not a big ingredient company. We had to prove ourselves in like the market to say like, hey, Solnul, are they legit? Can they supply? Like many of the things. And so our early adopters, I'd say a majority of the applications we're in are powdered supplements. We are seeing more on the bar side. So where they're bars, snack bars, and there's a few other product development projects now that we're working on that we're hopeful. The big watch out is, high temperatures baking hurt Solnul, right? And so we're one of those temperature sensitive ingredients that we can't be baked. And so manufacturers, brands, entrepreneurs got to get creative. We're really focused on health, shifting health. And there's just realities Mother Nature has given us where we have to, work with the nutrients and put them in an environment that they can land. And so, yeah, there's, I think over the next 18 months, we'll see a lot of other applications to kind of reunite microbiomes in our communities with Solnul.
Amazing.
And I can, maybe if I
yeah.
can just follow on there, I think, fiber maxing is a thing right now, right? People are trying to like really address the fiber gap, and most prebiotics are types of dietary fiber, and Solnul certainly is. And so one of the cool things that we're starting to see now is innovation in that really kind of ancient or like grand parental category that is your fiber blend, right? We're starting to see differences there. And what's really cool for us is that everybody's always talked about insoluble fiber and soluble fiber, right? These kind of different archaic views of this category. But what's cool about Solnul is it actually fits in the middle of both of those categories. So it does this by being literally insoluble. So if you mix it into a glass, it'll settle out. But it's fully fermentable. And this historically has only been a property of those soluble prebiotics. And so the thing that I kind of find really exciting these days is that people are almost pulling resistant starch out as that third category of dietary fiber. And so as much as, ready to mix powders have been kind of our sweet spot so far, I feel like we're starting to kind of see a bit of resurgence and a lot of interest in development in this category based on the idea of pulling out that concept of resistant starch and educating on it.
Really interesting. If looking at the ready to mix, more the dry format, if there's another category that you're like, oh man, we'd love to see industry explore this specific category with Solnul, what would that be?
There's fun formats. The reality, the explosion we're seeing, right, with the gummies, the shots, the gel packs, some of these innovative brands. I think we'll see some of those categories as well. I think and I don't know how we play or if we play. This is where creativity really needs to come in, and I'll bet on entrepreneurs all day long to kind of figure it out. But I think if ready to drink, you look what Olipop disrupted the soda market, right? America and North America's love for soda, and how they've educated, used prebiotics on there to hit a mass market. And now I think the last data I saw, they're like a top 3 soft drink at Target. Like it's wild what they've been able to penetrate. So I think we'll continue to see innovative applications where folks will be really centered around health. But that could be one, RTD.
Yeah. Amazing. My question was, if you're an innovator listening to this podcast, how can they get a hold of you? What's sort of the pathway to start, playing with your ingredients, or what's the best way to
I think lots of ways. I think reach out to anybody on the Solnul team, obviously, like the obvious LinkedIn website, but like we're talking with co-mans, like the manufacturing world that is like, hey guys, like why don't we see if we can like explore here? We didn't come from a product development background, right? We're not that space. And so we're learning in different, and we're allowing I guess, this is collaboration partnerships, right? Where it's like, it's synergistic for the co-mans that have that, or the manufacturers or the brand that say, hey, yeah, let's explore that. I think being a smaller, nimble team, when you start something from zero, right? You remember those 0 days? And you just kind of, so yeah, I think we'll have, reach out to us if you have innovation thoughts. But yeah, we're talking to people all around the world, you name it, that are like
Right.
trying to crack, yeah, health, I guess.
Yeah. Well, I mean, Christine, we're reaching this moment in time
This
of our
moment,
show.
this
But I do,
moment.
before we get to our big questions from previous guests, I love this part of our show because we always ask our guests is there anyone that you would like to recognize or shout out who has helped you along the way in your career, in your journey, or even in this space? And maybe Jason Bush, maybe we'll start with you, if that's all right.
It's really tough to kind of pin down names. I think one of the things that we've really benefited over the years is that, I think we're true to who we are. And I think our message and our objective, our why, is pretty transparent. We want to get this nutrient back into people's diet because it's missing and because we know it has potential. And I think being humble Manitobans, we're approachable, right? Jason didn't mention, you ask how to get in touch with him. Well, the guy's on the road like 24/7. So whether it be IFT, supply side, NBJ Summit, right? He'll be at all of those things. And that's really how we've gotten to, I think, the position we're at in the market is that we've really relied on those connections. A lot of the time we hear, well, it's not going to quite work in this particular application, right? We're temperature limited, we're insoluble. So there's certain places that make it tough. But because we believe in what we believe in what we sell, we're in a position now that we've kind of created believers. And so we have kind of this like almost like this resistant starch community out there. And they're telling other people, they're sharing our story. We're kind of like evangelical about our message, right? We joke that, I may be Dr. Bush, but Jason Leibert is Brother Leibert. He's standing at the pulpit. He's speaking to the value of this nutrient. And I think that that's really helped us unlock this opportunity.
Thanks for sharing, Jason.
Brother
Brother
Leibert,
Leibert,
what would you like to add
Brother
to this?
Leibert. I've been
What would you like
called
to add to
worse.
this?
I've been called worse. So I'll take it.
Amazing. Yeah. Who would you like to shout out to, Jason?
Yeah, I think
Leibert?
the health and wellness space is just a beautiful community. So it's people that have given us a chance to introduce ourselves, said yes when most say no. Whether it be industry veterans to, people that help on the clinical side, grab a bite to eat lunch. We've had some meetings. But I think it's just, yeah, it takes a village. Our team, no doubt, whether it be our board or team members, I think it's just like it's taken a village, and we're at a really exciting time. We continue to unlock R&D, and it's like what the brands are doing now in the marketplace is like things we couldn't even imagine because we never thought that way. And so so yeah, a big thanks, and we'll be big on paying it forward. So if there's anyone that has questions or has ideas, please reach out to our team.
Great. Well, thank you. And this is amazing because like the next question we typically like to ask where to next. We're midway through 2026. Jason Bush, you mentioned IFT coming up with supply side as well. You just finished. We're on the heels of Probiota. What else? Where else next for you all that you'd like to mention for listeners?
Yeah, we'll be at IFT in July. We're up for my nutrient ingredient award for microbiome modulation.
Congratulations.
I'm really proud
Yeah.
to be shut out from the esteemed panel of judges there. We'll be at NBJ Summit. We've got lots coming down the pipe. We just launched in April for Europe. And so we'll be spending some time across the pond, building that market, working with our partners there. As we, go beyond North America, go beyond Canada, the US, and that, yeah.
Fantastic.
Oh,
Ooh.
exciting initiatives for sure for 26,
Yeah.
27. I can't believe we're almost halfway through the year. Well, this is, we're at to the point where it's a question from our previous guest, and we're reframing it a little bit. So this question comes from Simran Kaur. So she works for Jiva Organics, which is a manufacturer of the product called Bliss Balls, but they're also a distributor. But we're reframing it for an ingredient. So her question is, what piece of advice or what is your secret sauce of adoption and buy-in for bringing unique and new ingredients such as Solnul? And Jason, maybe Liebert, I'll start with you first.
I was going to throw it to Dr. Bush, but
Oh,
yeah,
Dr. Bush.
you go first, Jason. I'll be cleanup.
Okay. Clean up. Okay. Hold on. See what kind of mess I can make.
Good
Okay.
teamwork. Good teamwork
Always
here.
be closing.
Oh my
Always be
gosh.
closing. All right.
Yes.
I think flat out the product has to work. If it doesn't
Yeah.
work, you can put as much window dressing or icing on that cake as you want. But if it's half baked, if it's not there, consumers won't buy it. But part and parcel with that, I'd say that the marketing, the storytelling, right, specifically being able to, what we're doing is we're working with the people who are making French fries, right? We're taking their co-product, and you guys use byproduct, but that's a dirty word. It's co-product, right? So these are things that used to go into the landfill, into the sewage lagoons, right? And now we're taking that material and we're upcycling it, we're cleaning it, and we're giving it a new life. And we like to think that we're elevating that material to its highest purpose. And now when you couple that with the fact that it actually works in people, and we hear all sorts of anecdotal stories along the way about, this is really helping me. I take that product. We hear that over and over. When you combine those two aspects, having a beautiful story that is that resistant starch granule coupled with efficacy, it's hard to lose.
Yeah. There's so many things I say, like, you look at Solnul where we are today, and it's like, how are we gotten just to this stage? We got big dreams and things we want to do ahead, and it's like 10 boxes. I won't get through all 10, right? It's like all the little things that make a product, or timing and economics and product quality and, ability to manufacture and all these things. But my big thing right now is science and like clinical trials. That's been a big component. We followed the science, and I believe, forget politics or marketing or like, we got to continue to follow the science, and the science will unlock value, and that value then can be passed on to all stakeholders, and ultimately the consumer will value it, and they're the ones that pull out. If they can see results and feel like they pull their dollar out, right? Everybody's kind of competing for that dollar and how they feel. And so I would just say R&D, fight for those R&D budgets, fight for clinicals when clinicals are under threat, because, right, there's decisions that need to be made. And I think our ethos is just like, continue to be curious on the research and follow that scientific pathway.
That's huge. Yeah. And definitely between both of you, it's like the evidence, let the evidence show in application. And Jason Bush, thank you so much for that, the co-product, not byproduct, the reframing, because that's so true. Because there is such value, especially, and I like that, elevating material to its highest potential. It's just like, it's elevated, and there's this new
because food needs to be the medicine, right? Like,
absolutely,
we're not, like, it is Hippocrates, all disease begins in the gut. Like, we have an obligation to the people that aren't in this community or in this world to unlock healthy and nutritious food that actually keep them healthy.
Totally.
Right?
Absolutely.
And chronic disease is really, hurting us in the West, especially, and around the world. And I just think, we have to feed the microbiome. And if we have a well-fed microbiome, good things will happen.
Oof. So good.
I love it.
Okay.
Oh, okay.
Okay.
It's their turn.
It's the time. It's your time. Yes.
Our turn.
We're
Not
going
leave the
to
question.
share
Correct.
for the next guest, not knowing who they are.
Yeah. So the question for the next guest would be, when you step back and look at nutrition in North America today, what are we making real progress in? and where are we missing the mark?
Oh,
So-
hot
gosh.
doggy. That's a good question.
Ooh.
Love to
That's
hear.
really good.
Okay.
Where we're
Okay.
making progress, where we're
Where?
missing the mark. Yeah.
Do you have a question, Jason Bush? Do you have one to share too, or is this a shared question
It's a
between the
dual
two of you?
Well, I was going to have a funner one. I was going to say,
Okay.
what's your favorite potato dish other than French fries?
I love
Love
it.
We love the potato.
I do too. The
do
little
too.
potato for me.
Little potatoes are excellent. Yeah.
Thank you both. Well, we'll keep you posted on what the next guests. We'll share both questions
Yeah.
for sure. So thank you both for those, and also thank you for your time. Is there anything that we didn't talk about today that you think that wow, we definitely need to layer in before we close?
No, I think appreciate having us on and sharing the story, and I just encourage all your listeners to think about the microbiome first and foremost and be curious about it so that they can educate other people in their circle and that. And if they have any questions, don't hesitate to reach out to myself, our team, Jason.
Yeah. And I would say for a podcast called Munching on Molecules, the microbiome is pretty much like right in your crosshairs. So thank you very much for having us on. Very happy to participate. And yeah, like Jason said, we're always happy to talk about all things microbiome. So please reach out.
I love it. There will be a part 2 for sure.
There has to be.
Has to be.
Has to
I
be.
love
It's
this.
just not enough time. Yeah. Well, thank you both so much. This has been such a joy to connect, and we're so happy that we got this conversation in the books, and can't wait for the next one to see where you guys go next.
Thank you.
Thank you.
Thank you.
Thank you.
And scene.
Scene.
Thank you.